glad they brought it up because I was going to ask that right now if it was contagious. So if you touch somebody that has it.
Right, so atopic dermatitis is not contagious. However, if you have a bacterial infection, that is contagious.
Like so with that raw skin that we were talking about?
Right, that's where it gets a little tricky. Also, you don't want, if your skin is raw, you don't want people touching it because then you're more prone to these type of infections. The thing about atopic dermatitis is that the barrier of the skin is compromised. So it's like the protective layer. So things get in there easier. So bacteria get in there easier, viruses get in there easier, even a fungus can get in there easier.
Because you're exposed.
Exactly. So that's where it gets a little bit tricky also with atopic dermatitis. So it's not contagious at all, but you don't want too much contact either.
All right. We have some pictures of eczema, and we're going to show a couple of them so you can see maybe what to look out for and the signs that you should see for yourself. So let's take the left one first, and that's obviously a little child. How cute.
Right, that's a classic eczema picture. Both of them are. The one on the ankle is a very common area that we see in kids also, in little babies like that. Any area like that, at that point you need to go see a doctor or a dermatologist because that needs a little bit of help. So if you don't treat that, it's just going to keep getting worse most likely.
And does it stay contained in that ankle area, or does it start migrating up?
It can change, yeah. Some kids have problem spots where they always will flare in those areas, but it doesn't necessarily stay in certain areas.
Now, I've seen eczema, like I'm looking at the left one now with the hand, and I see the red. Maybe it's not eczema, and I'm incorrect, Monica, but I've seen eczema that it's a little bit more whitish pink. Do the colors vary?
Okay, so here's what happens. If you have dryness, you can have areas of inflammation that might not be visible, so you can't tell it's inflamed.